This is a 30-day prescription, and these faded pills are the doses people skip to try to make a 30-day prescription last longer. This is what led me to my topic, prescription drug affordability. The problem is simple but damaging. The US pays 2 to 3 times more for drugs than other wealthy nations, and as a result, millions skip or delay medications, leading to preventable complications and hospitalizations, and the burden falls heaviest on vulnerable groups. To visualize who's most affected, I broke it into 4 key groups. Seniors and people with chronic illnesses make up the biggest share, followed by low income and minority communities. And it's not just patients, hospitals, clinics, providers also face rising costs and shortages. To understand affordability, I used 3 kinds of expert sources: research from the Journal of American Medical Association, the NIH, the Kaiser Family Foundation, and GoodRx; advocacy insight from AARP and the Medicare Rights Center; and policy information from CMS, the FDA, and the Congressional Research Service. Together, they give a full picture of the issue. To understand how we got here, here's a quick timeline. In the 1980s, protections expanded and the prices rose. In the 1990s, the US kept a market-driven system while other countries adopted price controls. In the 2000s, specialty drug prices surged. From 2010 to 2016, prices spikes like EpiPen brought national attention. COVID exposed how fragile access is, and federal reform arrived with the 2022 Inflation Reduction Act, with major changes rolling out in 2025 and 2026. In 2025, Medicare patients entered the first year of a $2,000 annual out-of-pocket cap. And next year, in 2026, the government begins negotiating prices for high-cost drugs. These steps don't solve everything, but they're meaningful progress. At its core, cost determines access, access determines health. This is where visual communication becomes important. Design helps reveal hidden systems, humanize data, and make complex policy issues understandable. Good visual design can create urgency and help shape public understanding, especially for issues people don't usually see. This campaign targets 4 main groups: policymakers who shape pricing laws, and providers and hospital systems who face shortages and delayed care, insurers and PBMs who control coverage and costs, and the public, including young adults who will inherit this system. All of them influence access, and all need clear visual communication to understand the stakes. Visualizing this issue helps us see the real systems behind it, the barriers, the inequities, and the human impact. And if we can visualize the problem clearly, we can change it. Thank you.